For World AIDS Day 2021, the theme is End Inequalities, End AIDS, End Pandemics. Global efforts to end AIDS and other pandemics such as coronavirus, influenza, dengue, and cholera are being impacted negatively by inequalities. The inequalities are evident in the differences between rich and poor nations and between persons in society, in the quality of health services afforded to members of the society, in the access to quality social protection provisions that can buffer people's economic circumstances, and in the violation of individuals' human rights. Those most affected in the context of the HIV pandemic are the key and vulnerable populations, which include men who have sex with men, transgender, sex workers, inmates, the homeless, people living with HIV/AIDS, the elderly, the disabled, as well as the economically disadvantaged, including children. Whether they are affected by HIV/AIDS or whichever pandemic, their exclusion is attributed to persistent cultural, structural, economic, political, legal, and policy roadblocks that must be removed. With the ending of inequalities, the ending of HIV/AIDS and other pandemics, there can be a return to normalcy and stability in day-to-day life. However, normalcy cannot be achieved if the disparity exists. The call goes out for significant investments in funding our public health services, the educational programs, the equipment, drugs, manpower, and other resources. The National Family Planning Board calls on you to join us in reaching our brothers and sisters who are being excluded. We commit to action and holding gatekeepers accountable to the pledges made on our behalf to end inequalities, end AIDS, end pandemics.